Can managing your window of tolerance reduce PTSD irritability? Imagine feeling like you're constantly walking a tightrope, trying to stay balanced amid a storm of emotions. That's similar to what managing your window of tolerance can do for those with PTSD. The window of tolerance is a term created by Dr. Dan Siegel to describe the ideal zone where your emotions are balanced enough to handle daily stress. When you're inside this zone, you can think clearly, process feelings, and respond calmly, even when things get tough. You might still feel anxious or annoyed, but you can manage those feelings without losing control. For people with PTSD, this window often shrinks. Trauma can make the nervous system more sensitive, so even small stressors can push someone into states of hyperarousal or hypoarousal. Hyperarousal is when you're overly activated, feeling irritable, angry, or hypervigilant. Hypoarousal is when you feel numb or disconnected. When outside the window, your ability to regulate emotions drops. If you're in hyperarousal, irritability and anger tend to spike. If you're in hypoarousal, you might feel detached or unable to react. Both states make it harder to function and can increase irritability. Managing your window of tolerance involves learning to recognize early signs of distress and using techniques to bring yourself back to that optimal zone. This can include mindfulness exercises, grounding techniques that focus your attention on the present, controlled breathing, or seeking support from others. The goal is to prevent or shorten periods of hyperarousal, which are often linked to irritability. Research shows that therapy approaches like trauma-focused cognitive behavioral therapy or eye movement desensitization and reprocessing can help expand this window. When your window is wider, you're better equipped to stay calm and respond thoughtfully rather than react impulsively. This can lead to a reduction in irritability because you're less likely to be pushed into emotional extremes by everyday stressors. If you struggle with irritability related to PTSD, working with a mental health professional can help you identify your personal triggers and develop skills to regulate your emotions. These practices take time but can significantly improve your ability to stay within your window of tolerance. Remember, managing your emotional responses is just one part of a comprehensive PTSD treatment plan, which should always be guided by a healthcare provider. In summary, the more you learn to stay within or return to your window of tolerance, the less likely you are to react with irritability. It's about building resilience and emotional flexibility so that stress doesn't overwhelm you. Always consult a healthcare professional for tailored advice, but know that developing these skills is a scientifically supported way to help manage PTSD symptoms, including irritability.